In the last few days of the exam, you should be revising the past year topics because these are the topics from which the questions can be asked. In this video, I will be discussing what topics questions have been asked in the past, from what topics questions have been asked in the past, and based on that, you can have a rough idea as to which topics to go through. So in 2015 for physiology, the question was on factors causing right side shift in oxygen hemoglobin curve. So you need to know about the oxygen hemoglobin curve, the factors that cause the curve to shift on the right side and the factors that cause the curve to shift on the left side. This becomes an important topic. Next, the topic was on tracts. So you need to know the different tracts, ascending, descending, the function, if there's a lesion, how will it present. That is it. So in 2015 there were only 2 questions. In 2016 one question was on parasympathetic nerve supply of stomach. The next question was on neurotransmitters. So there are 2 types of neurotransmitters, inhibitory and excitatory. There are different neurotransmitters under each of them. So you need to know the inhibitory ones, you need to know the excitatory ones and the level at which each functions. So neurons mediating direct inhibition in spinal cord are. So this is the question that was asked in 2016. Then next question was about Snellen's chart. Snellen's chart is used to assess DASH. Next, functional unit of muscle. So you need to know the muscle structure and function. Then for every 20 mmHg dash increase in PCO2, for every 20 mmHg increase in PCO2, pH changes by. So again, this is from respiratory physiology, that is important. So in 2016, these were the questions that were asked. In 2017, the first question was factors causing shift of oxygen hemoglobin curve to right. So again, factors causing it to shift to the right and to the left are important. Then the next question was macula densa in kidney is located in. So about the kidney structure and function, that becomes important. Then next question was somatostatin inhibits release of dash. So this is from hormones. So you need to know the different hormones, their function, location, about the secretion. Next, ovulation caused due to dash. So again, this is important. Acute or chronic hypercapnia results from dash. So you need to know about the different causes of hypercapnia. Yes, so that is it. Next, 2018, the questions were from lung compliance. Lung compliance is an important topic. Then applied physiology of hormones. So you need to know if the hormones are, if there is a deficiency or if there is increased secretion, how will it present clinically. So the applied physiology, you need to know about the different hormones. Then you need to know about the stroke volume, the factors affecting it, then the different types of anemia. Next, in 2019, a question was on surfactant. So surfactant, lung compliance, all these are important topics. Then cardiac cycle. Cardiac cycle, different phases are there, so you need to know about the different phases. Then muscle physiology is an important topic. Pacemaker and heart sounds, these were the 2 topics on which questions were asked. Also, one question was on blood transfusion. This was 2019 paper. In 2020, the questions were from again hormones, their secretion and function you need to know, the different tracts you need to know about the excitatory and inhibitory neurotransmitters. Then you need to know about the surfactant, you need to know about the different respiratory capacities, factors affecting stroke volume. Yes, so in 2021, again questions were from lung compliance, tracts, cardiac cycle. One question was from clotting factors. Then in 2022, one question was again on pacemaker of heart. Then one was about the function of utricle and saccule. So function of the utricle and saccule is something that you need to know. Then next was applied physiology hormones. So one question was from hormones. Yes, so that is it. So the important topics are first, you need to know about the different ascending and descending tracts, their function. You need to know how will the patient present with symptoms when there is a lesion at a particular level. Then you need to know about the oxygen hemoglobin curve, muscle structure and function, different neurotransmitters, inhibitory, excitatory, then kidney structure and function, surfactant, cardiac cycle, lung compliance, heart sounds, pacemaker, hormones. Hormones is an important topic. Shock, you also need to know about the different shocks. Then respiratory capacities, stroke volume is an important topic. Factors affecting stroke volume has been asked. Then clotting factors, you need to know about that as well. And 1 year, the function of utricle and saccule is also asked.